we like to call it. Tasso Spanos is here with us today from the Center for Pain Treatment. And today, Tasso's here to help us ease pain caused by sciatica. And we have our lovely sciatica model here with us today. Unfortunately, this is Patty Cobb. She is our floor director in real life, but she suffers with this kind of pain. Yeah.
Real life person with real life pain.
So here we have it.
Well, that's what most people out there in the viewing audience today are. Today we're going to talk about sciatic pain. Now, sciatic pain is, and we're going to do the duct tape, the masking tape again. Sciatic pain usually is this: a pain that goes down either the outside of the leg, right there, or it can go down the back of the leg. Now, they call it sciatic pain because the sciatic nerve can be entrapped by a disc. And usually, I find that if the pain comes on very quickly, in other words, you have a back pain and a hip pain, and then the pain down the leg, and then maybe your calf hurts, and it all happens within a week, it's probably an entrapment of the sciatic nerve. But if it comes on slowly, back pain a year, a little bit, 6 months on the hip, 3 months to get down the leg, a little bit into the calf, and finally the foot starts going numb, that probably is a muscular pain. Now,
how's yours been? Is it over the course of a year, do you think?
It's been over the course of
Can you hear her?
about 9 years.
About 9 years. So she has had this come on slowly, and she could not work if there was truly a sciatic entrapment. So the nerve, the sciatic nerve, can be entrapped by a disc or by a vertebrae, and also it can also be entrapped by a muscle called the piriformis. That's 20% of the time. What is the other 80%? It's coming from a muscle called the gluteus minimus. Now, there's a gluteus maximus. That's the big muscle everybody has in the back here. And under that is a gluteus medius. And then there is a little tiny muscle on the hip, which is called the gluteus minimus. So it sounds like a Roman amphitheater, doesn't it?
It kind of does.
Just like gladiator. Maximus, medius, minimus. So we're talking about the minimus. And this little muscle, and here's what this muscle does. It brings her leg away. It's an abductor. It abducts the leg away from the body. So when she's real bad and she needs to bring her leg out sideways to get out of a car that she's driving, it's murder. And anyone who identifies with this can feel sympathy for her. Now, I was on one time before, and your assistant Olga, she had a muscle called the quadratus lumborum, and that muscle makes the hip hurt. And that we'll just refresh everybody with that. If you have a hip pain, this muscle is above the hip line. So I'm just going to treat this very briefly because this muscle above the hip sends pain to the hip. And what's in the hip? Our new muscle, gluteus minimus. That's right. But we're going to have to work upriver a little bit and then work on her here. And Patty says that when she's bad, just to get to work, look at this, she's going back further. So we're releasing it and stretching. That's what our treatment is, pressing trigger points, which are irritated spots in the muscles. And then when they get released, we take that magic moment to stretch it to a new position or where it used to be before she had problems.
Does the pressure hurt a little bit?
It's tender.
Patty?
Tender? It's tender. Yeah, it doesn't kill. So that's part of the treatment. And the second part of the treatment is the stretch. So now we've got her moving better, and that sends problems to the hip. Now we're going in the gluteus minimus. The minimus is this little muscle right here, and I'm just going to press it right here. Now, people can get better with just the exercise portion. They don't need the pressing part. The pressing part is very fast. It's like having a month of exercises done. Now, we prepared a sheet of paper. And you don't have to bring the camera on this, but just a sheet of paper. If you call the office, and we'll send you this piece of paper on the 5 exercises that we recommend for doing a gluteus minimus stretch.
That's great.
And we have it all ready for the hundreds of phone calls that's going to happen today.
That's good.
Last time we really hit a nerve.
People will go. There you go.
Our phone lines melted. They just melted away.
We will have that number for you too in a minute. If you're watching, we'll have that.
That's 431-9180 in the 412 area code. 412-431-9180. Now, here's one of the exercises. She brings it back, and she goes around the corner like an attitude in dance. So if any of the dancers know, bringing back the leg, and bringing it behind. So the exercise, if you're standing, is you're bringing this leg back
Uh-huh.
and around. And that's going to be on the sheet of paper. If you call, we'll be glad to send that to you. Then I'm going to give her another exercise.
So she would be standing up doing that exercise,
That's
right?
correct. That's correct. All right, now why don't you get on your back just briefly, and I'm going to, and you can sit up. And another exercise she's going to do is this, is that she is going to sit up, and then she's going to take this leg and turn it, and put one hand on her knee, the other hand on the ankle, and then bring that towards the chest with, like that. At that crazy angle. It's a funny angle. It's not like bringing the knees straight. You know, you've done that before.
Yeah.
So you can feel that, can you?
Yeah.
That's the stretch. And then we have 3 more stretches. Why don't you stand, Patty? And I'll give you the other stretches. These are all, those 2 are the most important. Now you can see me a little better, and here's what I mean by an arabesque. I mean putting the leg behind the back. It's actually an attitude in dance.
That hurt?
That's life.
Yeah,
that's right. And she needs to do that 3 times at one sitting periodically during the day. Now the other exercise, we're just going to go like this. And this stretches both the hip muscles, it keeps her knees straight, but it also stretches, you can feel it on your hip a little bit. It's a gentle stretch compared to the other 2. Very gentle. And then the other one, you need a wall for this. This is her bad side where she has her stripes. She puts that foot in front of the other one like this. That's it. And then I'm a wall, and she holds onto the wall, and then she leans this hip towards me. That's it. Now make sure you're holding onto a chair or on the wall when you're doing this, because we don't want you flipping all over Pittsburgh here now.
So you're really feeling that stretch the whole way down, huh?
And so she's getting it at different angles. Each one is different angles. See, life is angles. I had a patient recently, she told me, I said, how did you hurt your back? She says, hurt my back? She says, I heard it dropping my earring. And I said, dropping your earring? What do you mean, some Fiji Island 50-pound earring that falls down and kills 3 innocent bystanders? No, no, no. She said, it was a normal earring, but it went under the dresser. So what'd you do? I said, well, I got on one knee and I couldn't reach it. Then I got on the second knee and I couldn't reach it. Then I got on my stomach and I couldn't reach it. And then I got it. And as I was bringing it out, my husband came in and announced that the IRS is coming to examine our books next week. Tension. Tension. Plus the bad angle. So life is angles. And this is why we teach an exercise class, my son and I, of 100 stretches for 100 different problems to take care of all the angles, to be prepared for getting an earring under the table.
or anything more.
That's right, that's right.
How often would Patty do something
If she's in trouble, she does these exercises, particularly the first 2, 3 of each, 3 seconds each, 5 times a day.
Okay.
And if she gets out of pain for one whole month, you've been in pain for 9 years, and one whole month, 30 days go by and you say, wow, I don't have any pain. Then you can drop them to 3. And then if you go the second month with no pain, he says, I can't believe this, no pain. And then you can go once a day. And since you've had this for such a long time, I would do 1 of these in the morning for the rest of your life once you're out of pain. Once you're out of pain.
Excellent. There you go. But you heard earlier they said surgery was really the recommended treatment. You're saying try this.
The sciatic nerve can get entrapped by either the disc or the piriformis muscle. But if it came on slowly in progression, then it's probably a muscular thing. And you try this and you get better, and then you will be in better shape.
All right.
And then one of the exercises stretches the spot where if they operate on you, it will get that so loose that the doctors and surgeons will have an easier time. They'll just love you.
So it's going to help anyway. All right. Thank you so much for coming in. Great to see you again.
I'd like to just mention one thing is that we have, I founded a school 10 years ago in Pittsburgh that teaches this. And it's the only school in the world that has a 650-hour program using those famous red books that I bring all the time. So the work of Dr. Travell, President Kennedy's doctor, is the textbook every day. And the next class starts July 12th. And if anybody wants any literature on that, give us a call at our pain center.
We have the screen for you. Here's how to reach Tasso Spanos at the Center for Pain Treatment. The office is located on Pittsburgh's South Side, and here is the number, 412-431-9180, 412-431-9180. There you go. We'll fix you right up.